see, I'll start by an example. This is like a 50-year-old man sleeping in bed, and he develops a clot in the coronary artery, which is the main artery supplying the heart. And this clot releases what we call as biomarkers, which is as they start to damage. Now, if the patient has a biosensor somewhere around in his body that can detect these enzymes, then what can actually happen is that these biosensors will detect the heart attack as it starts, and it will detect the heart attack as it starts, and it will send a message to the Amazon Dot or whatever artificial intelligence technology around in the home. And this technology will signal and will alert different parties that are responsible to take care of this heart attack. Like it will call the ambulance, wake up this patient who is not yet aware of his heart attack with maybe some quiet music so that he will not be alarmed. It will alert the hospital, the cath lab, and all his friends, and so you get the message here that this type of, or those small technology may make big differences. So all around this meeting, and other people are interested in modernizing healthcare and transformation of healthcare into a digital realm. But we all see that there are tremendous challenges, and I see that lots of the questions are about these challenges. So what struck us to go into this webinar now is that suddenly everybody is talking about these new technologies, and definitely in the Lancet, which is a very reputable scientific magazine, as you can see, they say virtual healthcare in the era of COVID-19. Now everybody's doing telemedicine and all sorts of e-health because of COVID-19. So it appears that COVID really created an opportunity by sort of not abolishing, but dissolving a little bit the barriers that were present. And these barriers are, as you can see, divided into individual, regulatory, legal, privacy, security, data ownership. So a lot of them are around. Maybe you can discuss them in details in another session, or maybe during the questions. But basically, I think they are regulatory barriers, the legal situation, and healthcare provider barrier, whether he's a doctor or a hospital or a clinic. Why would the clinic be worried? Because of the tribal behavior of people. So hospitals would be worried that they would lose businesses, individuals would be worried they would lose businesses, and they start forming these geographical barriers, resisting these changes. So these are just some of the barriers we can discuss in more detail. As you can see, that COVID did move also some of the barriers in Egypt, and our team, telehealth response team, immediately was mobilized to move many of our units to the COVID hospitals in Egypt. And our champion is, of course, Dr. Mohammed Dardiri, who is the spearhead now of Telemed. And he's been carrying this torch for more than 10 years. He's perseverant, he's determined to make things work. And our managing director, Dr. Wael Abdel Aal, our COO, who's also managing director of MedMark, one of the very prestigious healthcare insurance and companies in Egypt. So, and you can see Walid is holding our latest technology in telehealth. So we do have a practice that has been going on for 10 years. We've been in and out of different forms of telehealth. And as I said, this is the National Telemedicine Network, which we have been working on. And there are more than 120 units now. They were going reasonably well, but accelerated after the COVID. But we've done thousands and thousands of patients in all different disciplines.